Hello, everyone, and welcome back to the Beat Podcast, recorded live here in Los Angeles for Vive. I am so excited to have Therasa Bell with us today. She is the president and co-founder of Kno2. Therasa, welcome to the podcast.
Thank you for having me, Sal. This is exciting.
Yeah, so let us know a little bit about you and your company before we get into the questions.
Absolutely. Well, as you said, I'm the president and founder of the organization. Started it. Now we're 13 years old, serving I'd say one of the most difficult challenges that's yet unsolved in healthcare, but is really about connecting the entire continuum of providers so that they can exchange information at scale. So we've been hard at work for about 13 years, building infrastructure. So we've been laying the pipes for the information to flow at scale, patients' information to flow at scale for that long, and also very focused to connecting the parts of the continuum that have been overlooked for years. So very much focused to post-acute providers, to behavioral health, to vision, dental, emergency medical services, all these groups that actually perform more care than we see in the hospitals every day, but are never talked about. So those two have been our mission, and today we serve as the largest communication infrastructure in the United States.
Super cool. And what is it that got you into this? Like 13 years ago, what was the thing or things that led to keep getting into this?
Well, my whole career was based upon software engineering. So I'm a software engineer by trade. I spent all my time in healthcare, and I got to sit in multiple care settings and then in multiple personas. So I sat in the hospital setting. I've been in a physician office setting. I also worked on the insurance side, and I've seen kind of all the inefficiencies that were in healthcare. And then I worked for a company where we were building technology for healthcare, specifically to capture clinical information at the point of care in either structured or unstructured format. And based upon some happenings at that company, I was able to go out on my own and pursue a passion that I absolutely believed in, and being able to break down the barriers of communication. And that's what started it. And I always say I was waitressing by day and engineering at night and doing the work. And I loved it, loved what I do. And today we've really accomplished a lot as a company. I'm really proud.
That's great. Thanks for the story. And there's something to be said when you get to sit in those different seats. You see the problems, right? From the different.
Oh, 100%. Yes. Yeah. And it's like unbelievable, because people say healthcare, they use the word healthcare, and I say which part? Because healthcare for most people represents a doctor, represents a hospital, and that's what I would say the typical consumer thinks about when they think about healthcare. And then I said, do you understand how wide healthcare is? I mean, healthcare is everything from that acute care setting to a skilled nursing to a home health agency to physical therapy, and now we're seeing healthcare take on new forms of innovation and care models and telehealth and remote patient monitoring. And healthcare's word is always expanding, but with every expansion, it is really, really difficult to start connecting now that part, because the data is so big. The data sets are so big. So I actually get kind of dismayed when people compare healthcare to, they always use the banking industry. It's like, oh, we've connected every ATM in the United States. It must be that easy. Like, do you understand that they're working with a data set of 0 to 9. That's all they have to worry about is 0 to 9. And in healthcare, it's data is exploding. And what a physical therapist cares about versus what a behavioral health provider cares about versus a emergency med doc, very, very different, versus a dentist, very different information. So health information exchange is not easy. It's a difficult equation to solve at scale. And that's what drove my passion, and
I love it.
Every day I wake up with more passion than I did the day before.
That's so great. Well, you picked the right problem to solve.
Yes. I may not see it before I'm dead, but yeah, this would be fun.
Hey, 13 years in, it's a good run. Good run. Yeah. So talk to us about how Kno2 is using digital health and technology today to drive meaningful change in healthcare.
Yes, we are enabling it. So we have just under 300 technology partners and growing every day that have integrated to our infrastructure. So when I say that, we have an API that they connect to. It's called a communication API. And they'll take their technology. So I'll use the example of like a remote patient monitoring platform, digital health. They'll take it and integrate to our API behind the scenes. And so when they let's say they send a kit to a patient's house that sits in rural Kansas, they'll send the kit out there and it's connected. And so it can wirelessly connects to Kno2's network.
Okay.
And they're able to pull information from the primary care provider's office. They're able to share information with a specialist. If that patient shows up with, some sort of condition that needs to be escalated, referred out, or worse yet, maybe they need to go to the ER, we're able to share the information right out of that platform, no matter where it sits. That's one example of many that we have where we're just enabling access at scale. We say connect once, communicate everywhere, and we're enabling that information at scale.
That's fantastic, and it's bi-directional. So
Absolutely, absolutely.
Push.
Yep, absolutely, yes. And it's no matter what the format, right? So we leave no technology provider left behind, no electronic health record left behind, no matter if they have incentive to connect or not. Wherever they're at with their technology stack, they can adapt to our API and get connected and not have to make a huge overhaul of their technology.
That's great. What's the most important innovation your team is focused on right now, and what problem is it designed to solve?
Yeah, so we're focused, we're part of the national healthcare infrastructure that the federal government put forward with TEFCA.
Yeah, TEFCA.
And so we're very focused to TEFCA and to the CMS initiative under CMS Aligned Networks to making sure that our network supports those requirements. And they're constantly changing right now. It's a very dynamic industry. So anytime a regulation comes down or we get a new standard operating procedure, we're embedding about that. I mean, people don't often think about it, but if you think about in the communications industry, early on, especially with T-Mobile and Verizon and the constant sharing of data standards that they were having to go to build the infrastructure that we have today with 5G, right? And then now we're going to Starlink and everything else. That's what we're doing in healthcare, and building that kind of national infrastructure. That's our number one focus, is making sure we meet the regulatory and all those expectations. Second to that, we're really about going beyond just what we consider to be baseline with the national infrastructure. So how do we drive communication that's meaningful? You'll notice I don't use the word interoperability very often because to us, interoperability is a two-part equation. So not only the technology vendor, like the remote patient monitoring platform that connects to us and us, it takes both to drive interoperability. We're focused to how do we make sure we build communication, meaningful communication, so that when somebody connects to us, it's smart. It knows, hey, you're going to need this information, or hey, this patient needs to transition here. And we're constantly pushing that envelope with our infrastructure.
What's one thing that most people don't know about what you do?
How hard it is. I would go back to the question on, it's the analogies of, hey, the ATMs are connected. How hard can it be? And it's really hard. So not only the technology side of it, but also as you can imagine, the trust aspect of healthcare. People always say, well, we've got HIPAA, we've got cybersecurity, we've got encryption. Isn't that cover the need? And that's baseline. Getting to national, let me pose the problem. So in HIPAA, that was defined in 1995, 96 time period, where the provider was responsible. So as a patient, I go see my provider and I just trusted that they were managing my information and protecting it and only releasing it to who they needed to, right? That's what I signed my consent saying. You can release it to other providers. You can release it to payers when it's needed. Very basic. But the provider made the decision every time to push it out. So they would fax it out or they'd mail it out, right? That was the old world. Now we've inverted that problem, right? So now we have all of these different networks coming up where we've agreed as networks that we're going to be able to query and pull information from any system at any given time when I need it, right? So now you have unfederated exchange and pull of patients' information. So the trust equation has flipped, where I trusted you as my provider to send my information on before. Now I'm trusting you as my provider to make sure that you're putting the mechanisms in place that say when somebody comes and queries, comes in the back door and knocks on for that information at scale, that my information is protected going out the door. And that's our job as a network. So when I say it's hard. This is hard, right? Because it's not just technology, it's privacy, it's regulation, but it's innovation too. It's pushing up against innovation and making sure that we're not standing in the way of innovation, but we're not letting our patients' information just fly out, in cyberspace and be used by who knows what. So it's a constantly evolving situation that we're working through.
Yeah, that trust piece is key. And you hear a lot about cyber vulnerabilities and risks. And this is what we're talking about, right? Like setting things up, having the right governance. Talk to us about how organizations can prepare for something like that.
Yeah, it's I'm gonna actually flip your question a little bit.
Yeah.
So the first question is how are the networks ensuring trust? And we have a TEFCA governing body, so ASTP, which is part of the federal government, right, is providing kind of a core operating framework that says, you guys are going to trust each other. Here's what you have. Here's the standard operating procedures between each other. And then trust really moves now to the networks themselves. How do I know that? How does a technology partner, I'm going to go back to that remote patient monitoring platform, how do they know when they choose Kno2? That Kno2 is doing the right thing beyond just baseline requirements, like beyond HIPAA, beyond cybersecurity. Those are givens, right? You better be meeting high trust. You better be meeting HIPAA. How do I know then your ethics are appropriate? How do I know that you're operating at a different level? And we're actually the first network that we're coming out with what we're calling the Trust Accord. So if you're familiar with Anthropic, and most people are, right? Claude. If you go to Claude's website, do you know they have a constitution? And if you go out there, it's very interesting. And they were the first AI model to come out with a constitution. And the constitution, it's a very technical document. But the intent of the constitution is to say, this is how we're training our learning models. And they're using external sources, like they're taking the United Nations Bill of Rights and saying, this is the Human Bill of Rights. Our learning models read that Bill of Rights. And they were building against that Bill of Rights. So it's not Anthropic saying, here's the Bill of Rights. They put their own, of course, in there.
Oh, okay.
They're saying, nope, I went higher than that. I went to the United Nations Bill of Rights and my learning model. So Kno2 looked at that and said, we probably need something similar, that as a network, we're coming out with the Trust Accord. And this is actually being published actively to say, we're going beyond HIPAA. We're going beyond high trust. That's a given. You should expect that as a provider, as a patient. And we're moving to a set of 107 operating principles that says these are dynamic, and we're going to continue to make sure that we're making ethical decisions that are not commercially driven, that are for the provider, that are for the patient, and we're pushing forward on that. So to me, that's how trust has to be established in layers, because at the end of the day, trust is a prediction. I always say trust is a prediction of behavior, that based upon what you've done, based upon things that you've said, I'm predicting you're going to behave this way, and that you'll continue to behave this way.
I like that. That's a fresh approach to trust.
We hope so. We hope so.
I love that. And what's the business model?
Yeah, that's for us, without going into too much detail, it's a really good question, because from the beginning, when I say we went after the overlooked audiences, so we went after post-acute, behavioral, by going after those markets, they couldn't spell the word interoperability, not to be offensive to them. I love them dearly. Yeah. They couldn't spell the word. But they also didn't have any kind of economic incentive that was given to them, unlike what Meaningful Use drove $30 billion for hospitals and physician offices. They got zero. They've gotten zero to build this infrastructure. So we had to build an economic model that I always say could scale between the physical therapist that worked part-time in the strip mall and could pay $15 a month to be on the network, to a acute care facility or to a payer. Totally different economic, but we built to democratize healthcare communications. And so our economic models follow that nobody's left behind. Every provider can participate and afford it, and share the information that they need and be able to exchange information that they need.
Great. That's really interesting how you did that.
So, yeah.
Love that. So we talked about the health information exchange trust issues. What are you doing differently, right? Because you also mentioned there's other networks. So what are you doing differently that would lead people to choose you?
I think it goes back to that Trust Accord. That's what we're doing differently. Nobody else is publishing a Trust Accord. I would say we also, unlike what you hear in the media, and I'm going to say something that could be seen as contentious.
Okay.
The patient is at the center of everything right now, right? Patient-centered, we hear it. It is overused. It is under-delivered, for sure. And we absolutely believe the patient is at the center of things. But we fundamentally have built a business model that's for providers first. So our network, even though we believe patients need full access and rights to their information, our network is a network for providers. And every decision we make, every business model we come forward with, every even security decisions, privacy decisions, we make sure that the provider's protected, because at the end of the day, they're the last stop for care. And as a patient, if I trust that my provider's doing the right thing because they chose the right network, I win as a patient. So we've flipped that paradigm to say, yeah, patient-centered is a little overdone. It's provider for us, and patients win, payers win, everybody wins if the provider's protected.
They're the gate, right? I mean,
they're the gatekeeper. That's right.
Yeah.
Make sure that they're taken care of.
Sense.
So
the model makes a lot of sense. Where do you see the biggest opportunity for your company to make an impact over the next year or two?
Oh, it's a great question. So we have a very specific plan for the next 18 months. We're about 2 months into it. By contract, we have close to 200,000 provider organizations that we're bringing live on the network. These are the organizations that we targeted, right? So again, post-acute behavioral. Their EHR vendors have taken a long path, and these technology vendors, to integrate to our API, get their technology ready to be on the national networks, and now they're at the starting line to launch. So our team is very focused to building out the health information network from a part of the continuum that's never been online before. So I say we're putting 200,000 provider organizations on the internet in a secure way.
Interesting.
To share information as for patients. Where hospitals and, Epic and Oracle and all those groups have been there for 2 decades. These groups have not, and now they're going to be. So for me, this touches me dearly because my dad's 85 with Parkinson's. And when I bring him to a skilled nursing facility and I see that his records didn't make it over, I hold that as a personal burden that I got to fix. And that's what we're doing in the next 18 months. It's a very scripted plan.
I think it's fantastic. And are there any policy timelines tied to when this has to go off, or is it more so aligned with your initiatives?
Yeah, there's multiple policy. Well, policy from both I'd say a regulatory perspective and more a commitment. So one, there is regulation that says that people need to be online and that certain provider groups need to be online. But we also have the CMS Aligned Network Initiative. I don't know if you're familiar with what, in July of this last year, I went to the White House.
You mentioned that.
Yeah. So there's a group of us.
You were at the White House?
Yeah. I was sitting in the East Wing of the White House. Awesome. It was super fun. So I was sitting in the East Wing of the White House. That's and cool. There was a handful of companies that took a pledge with CMS in the room, with Donald Trump in the room, and saying, we're going to fix healthcare and we're going to make healthcare technology great again. And that pledge is sitting near and dear to us in terms of what we pledged for. So this next year, July 4th, the 250th anniversary of this country, is when we've pledged to bring forward providers online, when we've pledged to meet some of the expectation of CMS. And CMS has a lot of levers to pull. Payment is tied to it. So we have every reason to believe in the next 12 to 24 months that they're going to start tying participating in national exchange as a requirement for anybody that takes a Medicare dollar or a Medicaid dollar.
Oh, that's exciting. Finally, some financial push.
Our backs are against the wall, so I guess that's what it took as an industry, but here we are, and it's moving fast.
Well, Therasa, fascinating business.
Just thinking.
Incredible work by you and your team. The differentiator around, your what did you call them again? Your rules for engagement, or
the Kno2 Trust Accord.
The Trust Accord.
Yep.
The Kno2 Trust Accord. If people want to learn more, where can they reach out to you or the organization? Yeah.
So just info@kno2.com, sales@kno2.com, either one of them. And feel free to reach out to me on LinkedIn. I'm very active. I love engagement with the public. I encourage it and would love to have the discussions.
Outstanding. Well, there you have it, ladies and gentlemen. Therasa Bell, president and co-founder of Kno2, here at Vive, recording on The Beat. Check out the show notes, all the ways you could get in touch with her and her team on the work that they're doing to make our information network stronger and more accessible. Thank y'all for tuning in. And Therasa, thanks for being with us.
Appreciate it.